Hello, we're back, and in this video lecture, we're going to finish our discussion of coding neoplasms and get into coding lymphomas, leukemias, and those soft cell cancers. So let's have a look and get started. Oops. All right, one moment. Okay, so basically, we are going to be talking about coding these lymphatic and Hemat hematopoietic tissues. So there are several different types. Let's start with the lymphomas. Lymphomas are cancers that grow out of the lymph tissue, the lymph system. Multiple myeloma originates in the bone marrow, and leukemia is basically a form of blood cancer with abnormal leukocytes. And these are systematic diseases that spread throughout the body, but the concept of metastatic disease, as we used to see with the other types of cancer, really doesn't apply here. Lymphomas are classified as to the type and specific nodes that are involved. And then with multiple myeloma and leukemia, these are classified as to whether they're in remission, in relapse, or having not achieved remission. Remission is when the disease lessens in severity. The symptoms decrease, treatments discontinued, and it kind of goes into hibernation, if you will. Relapse is when all these symptoms and manifestations of the disease come back after a period of remission. And another important point is neoplasm related pain. Pain that's related or associated or due to a primary or secondary malignant neoplasm can be either acute or chronic. And depending on the reason for the encounter, whether it's a principal diagnosis or first listed diagnosis in the outpatient setting, that reason will determine which code comes first. Remember, we code everything that's documented and evaluated and assessed and treated at each encounter. So you may have pain that's present, but the patient's coming in for cancer, right? Versus being coming in and being treated for the pain. And again, malignant has we normally associate it with cancer. It can be also as a meaning that means becoming worse, and it can be resistant to meaning in the context resistant to treatment. You can have malignant pleural effusion. So we'd code the neoplasm first. We can have malignant ascent. So we'd code the malignancy first. Another important point is the current active case of cancer, if you will, versus personal history of malignancy. If somebody had malignant melanoma and it was excised with clear margins, this is an example of the history of. So you give this a Z85.0 through Z85.7, depending on the site. And that shows it's no longer active. So codes from this subcategory of Z85.8 may be assigned for the former site of a primary or secondary within this category. And that's all I have for you. Please reach out if you have any questions about coding cancer. Thank you so much for watching, and we'll see you online. Bye now.